There's a lot of, people with psychiatric disorders and their families that are drawn to these dietary therapies. And if they come to it on their own, they're motivated, they look into it, they learn what they need to learn, and they do it. And there's no doubt lots of people are deriving great benefits from this. But how do you go from that to making this something like a first-line treatment where doctors and patients all around the country and the world, somebody comes to your clinic and you say, here's what we should do?
Psychiatry researchers at Harvard Medical School and McLean Hospital are starting a new randomized controlled trial to look at ketogenic therapy for bipolar disorder. And we have the two co-principal investigators here to discuss the trial, the motivation behind it, what they think it can accomplish, and the details and challenges that come along with a ketogenic nutritional intervention trial. So let's hear what they have to say. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. I'm thrilled to be joined by Dr. Virginie-Anne Chouinard. She is the Director of Research at the McLean OnTrack program for first episode psychosis, and also Dr. Dost Öngür, who's a professor of psychiatry and chief of the Division of Psychotic Disorders at McLean. And they are joining me today to discuss this ambitious and exciting new trial that they are undertaking to look at ketogenic interventions for bipolar disorder. Now, before we get to the interview, though, please remember this channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. As we discussed in this interview, interventions even like starting ketogenic therapy for mental health disorders can be very dangerous if done without proper supervision. So always consult with your clinical healthcare team before making any changes. So with that, let's get on with this interview with Dr. Virginie-Anne Chouinard and Dr. Dost Öngür. Well, Dr. Chouinard and Dr. Öngür, thank you so much for joining me today at Metabolic Mind.
Thanks for having us.
Yeah, I'm really excited to talk about this study that we just heard about some of the details in a press release. And it sounds like a very exciting study looking at ketogenic therapy for bipolar disorder. But first, before we get into the study, I want to sort of rewind a little bit. And maybe, Dr. Öngür, we can start with you and tell me, what do you think sort of led up to you wanting to even look at this or study this?
Yeah, thanks for the question. This is an area of interest for our group for over the past decade and a little bit longer. We were not the first ones to study metabolic abnormalities in people with psychiatric disorders. In fact, this research really goes all the way back to the middle of the 20th century with people like Lou Sokoloff and Seymour Kitty and others doing heroic studies trying to understand brain metabolism rates. And then applying those same methods in people with especially psychotic disorders like schizophrenia, but also many kinds of bipolar disorder. But we got interested in this field through our work using phosphorus MR spectroscopy. That's a specialized modality using MRI imaging, brain imaging. There is no radioactivity, there's no needles. It's sort of like going into the MRI scanner to get an elbow or a shoulder scanned, like if you had an orthopedic problem. But in this case, we can actually collect information on brain energy metabolism. And we can do that in people without psychiatric disorders and in people with psychiatric disorders. And as we started to do this kind of research almost 15 years ago now, we were struck by some of the major abnormalities that we discovered in the brains of people with psychotic disorders. Even when they were relatively stable, they're getting treatment, and we're not challenging them or asking them to do anything special in terms of their brain activity or their bodily activity. But even then, you see major signals suggesting that there's something not quite right in how the brain synthesizes ATP, which is the universal energy currency molecule. And also some of the biochemical milieu around that process. Things like brain pH is more acidic in people with chronic psychiatric disorders. So we became very interested in energy metabolism abnormalities through that work. And naturally, we also started to ask ourselves, if these abnormalities are there, can we do something to help? Can these lead us to treatment interventions? And of course, we know quite a bit about treating metabolic disorders, from diabetes, endocrinology, liver disorders, and also mitochondrial disorders in neurology. but there was not a big literature in psychiatry. So my colleague Virginie-Anne Chouinard really took the lead in starting to explore several potential avenues. These included things like insulin administration to the brain, various other small molecules that are used as medications for other indications, but might actually be appropriate to enhance energy metabolism in the brain in people with psychiatric disorders, and ultimately to dietary interventions, which, based on what we know from the literature, are expected to have some pretty significant impact on brain energy metabolism. So that's sort of the big background that led us to proposing this kind of study.
Yeah, no, Dr. Chouinard, you've been involved in this field for so many years. I'm curious your take of now, sort of with McLean leading the way, this focus on brain energy and the focus on the connection between metabolic and mental health. Like, I don't know, how do you see that field evolving, and why do you think it's taken so long to sort of get to this point?
Well, I'm so pleased to be able to participate in this partnership with McLean and the Vizuki group to study ketogenic therapy in the early phase of bipolar disorder. We're really grateful for the support to allow this work to go forward and really to study an innovative treatment for early intervention. And the goal here being really to improve our current treatments and decrease side effects of treatment. Working here at McLean OnTrack, which is our program for first episode bipolar disorder and schizophrenia spectrum disorders, we're really trying to use a global approach to provide care to young people who are first experiencing bipolar disorder and related disorder. And early intervention is critical for people's recovery, their trajectory after a first episode, to help them work towards achieving their goals, whatever that may be. We're doing this new trial because we really need to find new treatments that work better for people, that have greater benefit for symptoms, and less side effects. And for the reason that, what Dr. Öngür was just saying, we have some really, compelling leads that targeting energy metabolism in the brain, with ketogenic therapies is going to help us accomplish those goals.
Yeah. Now, you've mentioned a couple times the term early intervention, and I think that's so important about this trial. There, studies have been done with people who've had a diagnosis for years or decades and been on treatment, but that's a little different in this study. So this really is focusing on early intervention. So tell us who the patient population you're recruiting for this trial is.
Right. So we're going to be enrolling up 50 participants that have that are in the early phase of bipolar disorder and related disorder like schizoaffective disorder, bipolar type. And so they're in the early phase within 7 years of first experiencing symptoms, and we'll be following them over time, over the course of the 12 weeks of the trial and extension period, which I can tell you a little bit more about.
Yeah. All right. So 12-week intervention, and this is going to be a ketogenic diet on top of their standard of care therapy. Is that correct?
Right. Exactly. So people are going to be continuing their usual psychiatric care during the course of the trial, continuing medications that they're on. And this is in addition to medications that people are already taking or therapies that people are engaged in.
Yeah. So now, Dost, I have a question for you. Now, you're the director of the Psychotic Disorders Clinic, and you've been involved in research for so long. When you're doing a research study and it's specifically on a diet, and not just a diet, but a ketogenic diet, how does that process compare to saying, oh, let's try this new drug? Have you been met with more hurdles or more skepticism, or how do you see that comparison?
Yep, both of those, and then other challenges as well. It's definitely a new direction for us, And there were a lot of decisions that we had to make, and a lot of barriers that we had to overcome. There's a lot of different things. For example, with medication trials, there's a well-established protocol about what the control arm should be. Sometimes it's an active treatment comparator. Sometimes it's placebo control. Sometimes it's treatment as usual. Depends on what the indications are. And then you can really come up with an answer to the question that's generally agreed upon. Whereas with a dietary intervention, it's really not clear what the right comparison should be. There just hasn't been enough data accumulating to tell us, in the following circumstances, here's how you should make that decision and that kind of thing. Another one is, where should the meals come from? You can train or educate people. You can provide dietitian support and have them change their diet on their own. Or another option is delivering meals to people so that they're actually not having to go through those steps. Another one is, how long should people be on the diet before we measure the outcome variables? Is it enough to change your diet for 2 weeks or 6 weeks? Or do you need a whole year? So there's a lot of questions here that, because the field is relatively new with dietary interventions, haven't been fully answered. And of course, we've tried to make, Dr. Chouinard has really done a lot of background work thinking and learning about some of these issues. And we've tried to make the best decisions that we think are going to help us, answer the important questions we want to answer. But I think it's going to also take a community doing different kinds of studies and learning about how these dietary interventions sort of, are implemented in the real world to come up with some of those standards the way we've had them in the pharmacologic studies.
Yeah, all very important considerations when designing a trial, especially a dietary trial. And don't even get me started on the 2-week dietary trials. Those just, I don't understand why anybody does a 2-week dietary trial personally, but I'm so glad it's 12 weeks. So Virginie-Anne just brought up a number of different questions about the control group. And so what did you land on for this trial? What is the control intervention? And then I want to hear more about sort of some of the outcomes too, but let's start with the control.
Yeah. So, this study is a 2-phase design. So the first phase is a 12-week randomized controlled trial, and we're going to be comparing a ketogenic diet and to a diet which follows the dietary guidelines for Americans. And in this first phase of the trial, people will be randomly assigned either to the ketogenic diet or to the diet following the dietary guidelines for Americans. And in the second phase of the study, after that initial 12 weeks, the second phase of the study is an open label phase for another 12 weeks. And during that phase, all participants will have the opportunity to either continue the ketogenic diet because they were assigned to it in the first phase, or start the ketogenic diet and be able to follow it over the course of 12 weeks. And throughout the trial, we'll be monitoring people closely for their symptoms, any side effects. We'll be doing MRI scans and metabolic measures. And each participant, whether they're assigned in the first part of the trial to the ketogenic diet or to the dietary guidelines for Americans, they'll be working with a dietitian weekly and as needed throughout the week as well. And we'll be monitoring blood ketones and blood sugar in both groups daily. So we have a wonderful multidisciplinary group here at McLean that we're working with that includes Dr. Fei Du, who's a neuroimaging biophysicist who's developed techniques for the measurement of factors related to brain energy metabolism that Dr. Öngür was talking about. And we're also collaborating with Denise Potter, who's a dietitian who has extensive experience in ketogenic therapy, in epilepsy, and recently in other conditions, including psychiatric. So we're really bringing together the expertise to ensure that people are really well supported during the trial.
Yeah, it's definitely an impressive team that you have there. But, looking at the press release, it it mentions that you're looking at energy metabolism, oxidative stress, neurometabolic markers, insulin resistance, and then psychotic and mood symptoms. Like reading this, it's like, oh my goodness, how much data are you collecting? It sounds like a big lift. I mean, were you somewhat concerned about that we're checking so many different things? This is going to be a big challenge, or it's just how research is done, and the more you collect, the more you're going to learn, and it increases opportunities.
Well, I think in our trials or in our studies that we've been doing, we've been really interested in those different dimensions. So that includes looking at brain energy metabolism, looking at metabolic factors like whole body insulin resistance, and seeing how that relates to how people are feeling. And we're really interested in finding treatments for early phase, like I said, that work better for people and don't have long-term side effects like some current treatments do, like metabolic side effects of weight gain or insulin resistance, movement side effects, or supersensitivity effects. So we'll be looking at sort of those different dimensions. How are people feeling during the trial? Does the ketogenic therapy affect their mood? That can be depression or symptoms of mania. How are they sleeping? How is their energy? We'll be looking at whether people are experiencing any side effects during the trial. Another interesting question is, are they able to decrease their usual medications during the trial and potentially have a reduction in side effects from usual medications as well? And then, as I mentioned, we're looking to see if nutritional ketosis is going to improve measures of brain energy metabolism that we know are dysregulated, and then more sort of global whole body measures that we have, like insulin resistance.
Yeah, I really like how you're measuring so much, but really bringing it back to correlate it with the clinical symptoms, with the mood symptoms, with the side effects from the medications, anything that's going to impact how the patient's feeling and how they're living their life, which is so important. So Dost, let me ask you, when you have a trial like this, how do you see the balance of looking for mechanisms versus the impact on the clinical care when you're like designing a research study? How do you see that intersection?
Yeah, that's a good question. Of course, in general, we would love to have both. And those are the best kinds of studies which provide some mechanistic insight while also providing clinically relevant information about what clinicians should be offering their patients and how we should be thinking about treatment. Oftentimes, it's not possible to achieve both. And in fact, of course, there's a very big literature on brain studies and psychiatric disorders that haven't really translated to treatment interventions. And people often talk about, some people say there is a crisis in treatment development in psychiatry, that neuroscience has advanced so well, and we know so much more about brain function now in the human brain too, not just in preclinical models. And yet we have not been able to parlay all of those advances into treatment improvements. I think here we have really kind of a unusual opportunity to do something which to study an intervention which gives us a window into brain mechanisms of energy metabolism and how the biochemical processes support neuronal function, but also it's directly clinically applicable. So we would really, at the end of the study, love to be able to say, when you go on a ketogenic diet, here are some of the changes in brain energy metabolism in humans with psychiatric disorders. We're making these observations, but also that here's the kind of ketogenic diet that's associated with the kind of psychiatric improvement and, all these other measures that are also getting better. So I think this is really a relatively unusual intersection of both of those imperatives.
Yeah, I think that's a great way to summarize that. Now, obviously, you don't know what it's going to show. That's why you do the trial, to see what it's going to show. But Virginie-Anne, what do you hope the impact of this trial could be? I mean, and to lead you a little bit, do you think it could be, okay, we're going to change the way we offer treatment now? Or will it be, okay, this opens the opportunity for more research studies to help narrow that down a little bit more? Like, how do you see that at the end of this trial?
I think that our experience working with young people who have early bipolar disorder is that they're really looking for alternative treatments, to, alternate new treatments to feel better, and to avoid side effects. And nutritional ketosis really specifically is we think is targeting known energy dysregulation and could potentially provide targeted relief from mood and psychosis without metabolic side effects of other treatments that we have. And I think that if we, the data really comes together, we have some really promising leads that that nutritional ketosis can really be beneficial in these ways. And having this and developing these better treatments in the early phase of bipolar disorder, I think can really help change people's trajectory and their ability to achieve their goals. So I think it's going to be the data trials that are being done right now really coming together to show us that this is something that really could be beneficial for people.
Yeah, and I think one of the most amazing things about ketogenic therapy is it is sort of, you can think of it as a two-pronged approach. Like one could be to treat the metabolic dysfunction that is associated with antipsychotic medications or other psychoactive medications, and the other could be to treat the actual psychiatric mood disorder symptoms, et cetera. I mean, you listen to someone like Ian Campbell and his, I love his quote. He said, I figured if I was going to be depressed, I at least didn't want to be fat and depressed. So I went on a ketogenic diet and lo and behold, it lifted my depression. I mean, that's how he phrases it. So it can be used for both sides. So based on that though, so many people would be like, well, I could just start it then. Like, it's not a drug. I don't need a prescription. I can just do it. So, what sort of thoughts or concerns or encouragements you have when it comes to someone just wanting to try it and see what happens when they have a diagnosis of bipolar disorder or schizoaffective disorder or other?
That's a great question. I do think that it's really important that that people understand that this is a therapy, and that it does require monitoring and working with a clinician or a dietitian, I think is really important. There's certain lab information, so blood work that people should do before they start the ketogenic diet, and that should be monitored while at different intervals while they're on the diet, which we'll do in the trial, and that can also depend on the different medical comorbidities or medical conditions that people have. So I do think that that's important to keep in mind for people.
If I can put your last two questions together, I think, what do we want to learn from this study? Where do we want to go? And then what is the way to think about, going on a dietary therapy like this? I think, what we really need to learn more about is how to scale up from where the field is at right now. What I mean by that is there's a lot of, people with psychiatric disorders and their families that are drawn to these dietary therapies. And if they come to it on their own, they're motivated, they look into it, they learn what they need to learn, and they do it. And there's no doubt lots of people are deriving great benefits from this. But how do you go from that to making this something like a first-line treatment where doctors and patients all around the country and the world, somebody comes to your clinic and you say, here's what we should do. Because there's going to be people who don't want to do it, or they try and they can't do it very well, or there's some other barrier that's getting in their way, or they have a medical condition and so on. So we need to learn about how can this therapy be easily scaled up? How can it be presented? How can we support people to do it? Does it work for everyone, or are there subgroups of people where, we know it's going to work better than others and therefore we stratify? So there's a lot of those kinds of questions. Hopefully, our study will be part of that, contribute to that learning process figuring out how we can do this more effectively for the broader population of patients and their families. And then as part of that, it's going to be safety, because it's not necessarily a benign thing. We need to be careful for people with certain medical conditions. Maybe the diet's not a good idea, or it should be modified in some way, and so on. So learning more about a lot of those issues, I think, is what's needed from this kind of research.
Yeah, so important, so important. I really like how you're looking forward to what's it going to take, if this is effective, what's it going to take to make it more of mainstream care, because, that's important. We don't want just 5 or 10 or 100 people to know about this. We want,
right.
If it's going to work and be an effective and safe therapy, we want everybody to know about it. So
right.
important. Well, I am very excited about this trial. I really like the design. I like the RCT setup, the number of outcomes that you're measuring, the open label at the end to allow people the opportunity to try it. I just really, in the multidisciplinary approach, is just so fantastic. So if someone wanted to learn more about the trial or enroll in the trial, where would you direct them to go?
So we have the trial is listed on clinicaltrials.gov. And if people are interested in learning more about it or even participating in the trial, they can go on to clinicaltrials.gov, and there's contact information on there and information about the study too.
Great. And you're both at McLean, so if they wanted to learn more about either of you, I guess would McLean be the place to go?
Yeah. Yes, yeah, definitely.
Great. Well, thank you so much for joining me, and I can't wait to have you back when we can talk about the results of the trial and see what you found and dig deeper into it.
Look forward to it.
All right.